Stereochemistry. What is the stereochemistry? The chemistry of 3D molecules. Look at propane in 3D shape and propane in normal shape. A stereochemistry is a branched chemistry involves the study of relative spatial arrangement of atoms that form the structure of molecules and their manipulation, and is called the heart of chemistry. Stereochemistry divided into two parts, chirality and isomers. What's the chirality? It means handedness. Divided, chiral and achiral. Chiral, an object that has non-superimposed mirror image. It means different something.
Like shell and like Cinderella shoes.
Achiral, it is superimposed mirror image. It means the same. The isomers mean that compounds have the same molecular formula.
Isomers is like the twins. They look like there, but must be some different.
The part of the isomers are structural isomers and stereoisomers. Stereoisomer divided into configurational and conformational. Conformational, that means the compound can be interconverted by rotation about single bond. Configurational, that means the compound cannot be interconverted by rotation about single bond. Divided to geometrics and opticals. Opticals isomers have no double bond. Divided to non-smear and isomers. Geometrics, the isomers have double bond. Divided to cis and trans. Cis means that compounds have two groups at the same side. Trans means that compounds have two groups at the opposite side. For more explaining about cis and trans, we will take clomiphene.
This is the structure of clomiphene, which is contain geometric isomer, because we have two carbons that bind by each other by double bond, so that lead to get two isomers. The first one is cis in the same side, and the second one is trans in the opposite side. Now, to know if it is cis or trans, the first step, we look at two carbons that bind by each other by double bond, and the second step, we compare between the substituted of this carbon and take the higher atomic number. In this carbon we take the fluor and make it number 1 because it has higher atomic number. And the second carbon, we compare between this substituted and we take this benzene ring because it contains oxygen atom and this benzene without oxygen, and make it this ring number 2. Number 3, when we compare between number 1 and 2, we find it is in the same direction. This and this in the same direction, and this structure is called the clomiphene. And if it is trans, the structure it will be like that. And the chlor and this benzene, it will be in the opposite side, and this structure it called in clomiphene.
This is structure of clomiphene in 3 dimensions. What is clomiphene? Clomiphene is non-steroidal fertilizing medicine. It uses the pituitary gland to release hormones needed to stimulate ovulation, the release of an egg from the ovary. Clomiphene is used to cause ovulation in women with certain medical conditions such as polycystic ovary syndrome that prevent naturally occurring ovulation. The mechanism of clomiphene has mainly anti-estrogenic effect and some estrogenic effect. The mechanism in stimulating ovulation is known, but it is believed that related to properties by anti-estrogenic competing with estrogen clomiphene for binding site at hypothalamic level. FSH and LH increased, which result in secretion of urine follicle maturation.
Clomiphene actually blocks estrogen receptors of hypothalamus and pituitary. Estrogen is made by these cells we talk about, granulosa cells, and estrogen feed back to the pituitary and to the hypothalamus, the area of controls of pituitary, but it blocked down by clomid. So even now the estrogen level never be normal, the brain still saying low estrogen, and sends the signal increasing the follicle stimulating hormone, then come down increasing the number of granulosa cells, or even cause one of these cells envelop, hence the possibility for twins. So you stop taking the clomid, then we would anticipate the ovulation some days thereafter.
Important information, don't forget, don't use clomiphene if you are already pregnant. You shouldn't use clomiphene if you have liver disease, abnormal vaginal bleeding, gland or thyroid disorder, ovarian cyst. Clomiphene side effect: stomach pain, nausea, vomiting, diarrhea, rapid sweating again, especially in your face, and midsection, no or little urinating, breathing pain when you're rapid heart rate, feeling short of a breath, especially when you're lying down. 50 mg orally once a day for 5 days. The benefits of stereochemistry: 1. Increased receptor selectivity potency, decreased adverse effects, decrease the dosage given, decrease of potential drug, increase safety margin.